everyone. Thanks for tuning in to my videos. For those of you who are new to my channel, my name is Dylan. I'm from the Chicago suburbs, and 1 year ago today, I had a surgery called pudendal nerve decompression surgery. It's a controversial surgery to treat pudendal neuralgia, which is a pelvic nerve issue. I had stinging, stabbing, shooting pain on the left side of my pelvis. The pudendal nerve is one of the main nerves that controls the pelvic floor. It arises from the sacral nerve roots S2, 3, and 4. A year ago today, I was in Phoenix, Arizona, having surgery with Dr. Michael Hibner. I was out there for a month, and while we were out there, the pandemic was underway. The lockdowns were happening. I'm so grateful that I was able to stay in Arizona for a month and kind of waited out a little bit until things were a little bit more known. Although when we went and returned to Illinois in April, the pandemic was still underway. It's been a long, grueling year for me, mentally, emotionally, physically, all of the above. The surgery is a bit controversial in nature to treat pudendal neuralgia. I had been in pain for a good 7 years prior to choosing pudendal nerve decompression surgery. It's definitely a last resort surgery that you all want to consider after trying any and all other options for treating pelvic pain and pudendal neuralgia. Pudendal neuralgia is a very specific neuropathic pain in the pelvis. Mine presented in stinging, stabbing, shooting, sometimes burning pain. In my specific case, I wish I would have waited to have surgery and done a better job of ruling things out. There's definitely a lot of other factors that can contribute to pelvic pain that you should have ruled out prior to having surgery, as well as doing treatments. So treatments is one thing, and also ruling things out is another thing. There's all these little things, genetic conditions, vascular compression issues, pain, spinal issues, gastro issues. There's all these other things that you need to have ruled out that doesn't directly concern the pelvis, but can be contributing to pain. Pain expresses in the body very weirdly. It's not always directly on the spot. It's sometimes you experience referred pain. Sometimes people deal with prolapses or other diagnoses that could play into the nerve being set off. I would encourage anybody to change their diet as many times as possible and to try as many medication combinations as humanly possible prior to surgery. I know neuropathic pain is quite devastating. It causes you to have to reconfigure your life. I had to quit my job in late 2019 and transition to a new role in my job. Thankfully, I was able to work remotely and still am able to work remotely. I don't know what I would have done had that not been the case. I would highly advise people considering this surgery to go to Europe, and because Europe is a lot better at different approaches, different options in terms of surgical methods. In the US, there's pretty much only one or two methods to getting to the nerve, and usually it's very invasive. My method was the transgluteal method, which covers the most area of the nerve, but it is the most invasive. And I discovered that I have a genetic condition called Ehlers-Danlos syndrome. And with Ehlers-Danlos syndrome, the collagen in your body is defective and compromised. Collagen makes up blood vessels, organs, and joints and ligaments, and the main ligaments involved in protecting the pudendal nerve, which are the SI ligaments, the sacrotuberous ligament, the sacrospinous ligament. Me having surgery definitely complicated things because ligaments and nerves are the last on the totem pole for the body to heal. So with this surgery, you can expect a recovery time, or at least not expect to see results until as far as 2 to 3 years post-op. Some people notice improvement right away. Some people notice it, within that year time frame, and some people have to wait a lot longer. Like in my case with EDS, tissues, like I was saying, the ligaments that are already compromised tend to take a really long time to heal. So I'm guessing that it will take me 2 to 3 years to notice full improvement. Um, do I regret having surgery? Maybe a little bit. Sometimes I kind of go back and forth between should I have or shouldn't I have had surgery. I learned a hell of a lot of information between the time I had surgery and now, so I am forever grateful for that. I met a lot of amazing people along my journey. I've been advising people that have pudendal neuralgia as well as Ehlers-Danlos syndrome, as well as joining support groups for this whole time. And I will say that it has brought such enrichment to my life. Physically, my symptoms have kind of teetered between sort of returning to what it was pre-op, but some days I definitely feel worse than before. But my main complaint is no longer neuropathic pain. Granted, I still have very terrible episodes of neuropathic pain, but my main complaints are abdominal pain, lower left abdominal pain. Definitely vascular issues have gotten worse since surgery. And so I deal with mostly lower body pain, legs, pelvis, abdomen, and I'm currently battling a lot of gastrointestinal issues. I don't know what I can eat from day to day, and it's not a diet issue. It's a mechanical issue with my digestive system that I'm still trying to figure out, and I don't think I'll figure that out for a very long time. People with EDS tend to have a lot of gastrointestinal issues because the collagen that surrounds our organs is weak. The ligaments that hold up our organs are weak, so it causes a lot of prolapsing problems, which I think I'm dealing with, as well as dysmotility or mechanical functional issues with the organs. So if I go and get blood work done, my levels of things are going to just show normal, and my next steps on my journey is to kind of dive more into the gastrointestinal issues, potentially work with a dietitian again that has knowledge about functional gastro issues, doing a SIBO test, which is small intestinal bacterial overgrowth, which I've been asking for at least a year now, and nobody has offered that test to me. The gastric emptying test I'm doing on Monday to determine if I have gastrophoresis, which is basically an autonomic issue with the gastrointestinal system. I'm back doing physical therapy twice a week, in which the focus of my PT is not internal pelvic work. It's basically just visceral and myofascial release work, which is all done externally to manipulate the connective tissue and organs to kind of help me cope with the pain. It doesn't cure anything. It just helps me maintain from week to week. I did take a break with physical therapy for a while, and then I went back and they noticed a lot of tension in my body. So I have to keep ahead of that if I want to maintain my progress. Since I'm not doing internal pelvic work, I think my nerve issues have kind of been at bay a little bit more so. It's kind of hit or miss with pudendal neuralgia and pelvic floor PT because some people flare up really badly afterwards, and I do notice if they work directly on that nerve or the surgical site, I do have bad flare-ups, but as long as they stay away from it, I do pretty okay in PT. I'm going to be investigating more vascular compression issues coming up. I think I may have my nutcracker syndrome is worsening, which is a kidney vein compression, as well as I may have compressions higher up in the GI tract that I haven't explored yet. I was thinking that also prolapsing is an issue for me because people with EDS tend to have hypermobile organs. That's kind of what I joke with people that my party trick is that my internal organs do yoga whenever they feel like it. I think my bladders, I definitely have bladder problems still. I have the other thing that with me 1 year post-op is that I have been able to sit for a little bit longer periods of time. So I can sit for 15-20 minutes and not have pain through the roof anymore, depending on how my pain is presenting that day. If my pain is presenting more with abdominal discomfort, I can tend to get away with sitting for longer periods. I have to sit up after I eat food because of my digestive system, so that's kind of prompted me to do more sitting. I still am not comfortable driving a car with the vibrations and the sitting and feeling like I can't get out of a situation. I just don't feel comfortable driving. The other thing too is I do have a lot of bladder pain, and if I'm not near a bathroom or if I eat too much or use the bathroom, it can trigger pain issues. So it's definitely a chain event or a chain reaction in my body. When I do one thing, it kind of affects the whole abdominal area and it can set off pain episodes. So I really don't have a social life in person anymore. Most of my interacting is done online. I'm part of Zoom groups, like I mentioned. I am resuming doctor's appointments and PT. I try to walk twice a day just to get my exercise. I'm able to walk for short bursts at a time. I do need to take breaks because of my dysautonomia symptoms get worse. If you guys don't know what dysautonomia is, it's basically a dysfunction of the autonomic nervous system, which controls your heart rate, breathing, gastric moving, etc., blood pressure. These are all things that are not under conscious control of the nervous system, and the pudendal nerve does have autonomic fibers, because if you think about it, the pelvic floor needs to remain closed, otherwise you'd be peeing yourself 24/7 if the autonomic nervous system wasn't doing its job on the pelvic floor. So it makes sense with that nerve. Pretty much 1 year post-op, I sort of have mixed feelings on where I'm at. If I regret the surgery or not, I kind of go back and forth of I shouldn't have done it versus I'm glad I did it. And that's kind of where I'm at mentally. You know, the first 6 months were excruciating. The surgical pain was just awful. Again, my advice to anybody that's considering doing the surgery, if you're going to do the surgery, do your research the surgeon, research the methodology, and honestly consider going to Europe, because they do have laparoscopic options in Europe, whereas that they don't in the US. And make sure you have ruled anything and everything you possibly can. Rule it out. Go get the genetic test. Rule out rare disorders that may be contributing to pain. Go and see specialists that work with organ systems that may not directly affect the pelvis. And also have a plan in place. Make sure you're on disability or you have work accommodations that allow you to work from home, because your entire life will change after this surgery. So make sure you have a plan in place. Make sure you have a support system. Make sure you've ruled anything and everything out that you possibly can. Happy 1 year anniversary to me. I did not ever think I would make it to this day. But the day is finally here. 1 year ago today, I was in Phoenix, Arizona, having a 4-hour surgery, the most extreme surgery that I've ever done in my life. Again, if you have any questions or comments, reach out to me on Facebook, on Instagram. Embrace the World in Gray is my username on YouTube and Instagram. Feel free to message me. My DMs are always open for questions, and I will talk to you guys later.